All right, so we'll be doing a lot of chemical pathology. Um, this afternoon, I'll be moving through a lot of concepts, as related to chem parts. So the first one we should be looking at is what the ENA. All right, so basically we are looking at various definitions that you could possibly see in chemical pathology. So ENA is what is known as the extractable nuclear antigen. Extractable nuclear antigen. So what is this extractable nuclear antigen, and how can we go about it? So a lot of things on the screen you can actually pause to observe. So for the ENA, let's proceed. It just refers to actually what a group of proteins. It's not one thing. Do you understand? It's not a single stuff. So it's a group of protein within the cell nucleus, and they can actually trigger auto antibody formation. Do you understand? And they usually do a test for them, and they usually use this test when you are suspecting that the patient has what a an autoimmune disease like lupus erythematosus, Sjögren syndrome, scleroderma, mixed connective tissue disease, and all of that. So once you do it and it's positive, that's to tell you that you have a lot of auto antibodies moving in the body that are basically could actually attack the body's own cells and all of that. So they are soluble nuclear and cytoplasmic proteins, and they can be extracted from the cell nuclei using saline. That's why they call them extractable nuclear antigens. Their role in disease, they are autoimmunes. Okay, not them though. They can trigger. So when they trigger, the autoantibodies will attack them. Do you understand? Leading to autoimmune disorders. Attack them, attack other cells. So clinical use, when they are doing a test for this, they want to actually see if you have an autoimmune condition, if you have ever seen it in the hospital. All right. So they can be extracted, from the nucleus. All right. Extractable what? Nuclear antigens. All right. So common antibody tested in a panel. If they want to do a panel, that's to test. I will tell you that it's a group of antibodies. So they can test for what? Anti-SSA, they call the RO, mostly for Sjögren syndrome and systemic lupus erythematosus. Anti-SSB, anti-Smith, anti-RNP, anti-SCL, the anti-Jo1, okay, for poliomyelitis, dermatomyositis, interstitial lung disease. This one for scleroderma and systemic sclerosis. So when we doctors want to order for this test, if they are suspecting that you have an autoimmune condition, maybe you're having all those joint disorders, rashes, dry eyes, dry mouth, muscle weakness, anything that is suggesting that probably your body is fighting against itself, they order for this test. So how does it work? They collect your blood, simple blood draw, okay, no special preparation. If it is positive, shows that there's auto antibodies dictated. If it is negative, shows you that there's no auto antibodies in the system. So a positive test will show that there is what an autoimmune, disease.